These are the most common face shapes. Round face. If the patient's face is round, we try to balance it with angular frames such as square or oval frames. Square face. For patients with a square face, oval or round frames would be best suited. Heart shape. A patient with a heart-shaped face can choose a round or oval frame. Oval face. Oval face patients are quite versatile and can wear almost all shapes for their facial structure. Large frames like aviators and wide square frames would bring balance to their narrow face. These are the 5 most important areas to pay attention to when fitting a pair of frames. The height. The frame should not cover the eyebrows. The frame should not lie across the patient's upper lid. This can cause the patient to look over the frame rather than through them. The width. The frame should not be too wide across the patient's face. If 2 or more fingers can fit between the patient's face and the frame, then it is too wide. Also, if the frame is too narrow, the temple should not press into the patient's face, leaving a dent. The ideal fit is that the temple lightly touches the patient's face without dropping if the patient tilts their head downward. The bridge. In a metal frame, the nose pad should rest flush on the patient's nose. If it does not, as in the photo, the nose pads need the necessary adjustments. In plastic frames, if the bridge is too small, it creates tension on the sides of the nose. When the bridge is too high, it does not rest properly on the nose, leaving a gap between the nose and the frame. The ideal fit is that the frame should rest comfortably on the patient's nose without leaving a gap. The temple. The handle of the frame should not press on the patient's temples. This can cause tension and even headaches. The ideal fit is that the handles rest lightly on the patient's temples. Fitting around the ears. The curve of the temple should not be in front of the ears. In this situation, the handles are too short. Also, if the handles are too long, they can get stuck in the patient's hair. This can cause pressure on the hinges of the frame, which can cause premature damage. The ideal fit is that the curve of the temples should sit right over the ears. Measurements. The first measurement we will look at is the pupil distance, or PD. In measuring the PD, have the patient look at your left eye. Rest the ruler on the patient's bridge for support. Begin measuring from the center of the patient's right pupil. Then direct his or her eyes to your right eye. Proceed to measure the center of the left pupil. Measuring mono PD. The mono PD is the distance between the nose bridge and either the right or left pupil. This measurement is important because in many instances, these measurements will be slightly different. Hold the curve of the ruler over the patient's nose bridge and measure the center of the pupil from the point of the bridge to the center of the patient's pupil. Progressive heights. Ask the patient to put on the frames where they feel most comfortable. Just like the PD, have him or her look at your left eye. Using a thin point marker, mark the point where the center of the pupil lies. As the patient looks at your right eye, mark the point where the left pupil lies. Measure from these points to the edge of the frame. Your minimum height for progressive should be 18 millimeters. Bifocal heights. These heights are taken from the lower lid to the edge of the frame. Again, the patient will look at your left eye while you mark just below the lid. Repeat the same for the right eye. Your minimum height for bifocals should be 11 millimeters. Collection. When glasses return from the laboratory, the following steps should be taken. Check for the accuracy of the prescription. Check if the glasses are straight. If they are not, the necessary adjustments should be made. Call patient to let them know their glasses are ready. Whilst the patient is in store, fit glasses on the face. Take a thorough look from the bridge to the side of the ear to make sure the glasses sit properly and comfortably on the patient's face. Ask the patient to look at a distance. If the patient is using progressive lens, make sure that the markings accurately lie on the patient's pupil. Have them read the chart for clarity of vision. Check if the glasses are tightly fitted by using your index finger to pull the frame forward. If they fall off too easily, make the necessary adjustments. Ask them how they feel. Call the patients within 2 weeks post-collection to find out how they are adjusting.